age psychiatry and addictions psychiatry. She's a fellow of the National Postgraduate Medical College of Nigeria. She had a Bachelor of Medicine and Surgery from the College of Medicine, University of Lagos in the year 2005. She worked briefly at the Lagos State Health Service Commission between 2008 to 2014 when he joined Federal Neuropsychiatric Hospital, Yaba, till date. He's a member of the Nigerian Medical Association, Association of Psychiatrists in Nigeria, and International Society of Substance Use Prevention. She's diligent, dedicated, and always looking for avenue to impact positively on others. She is married with children. Our second presenter today is Dr. Immaculata Nwonu Ezeanya. Dr. Immaculata is a seasoned and licensed clinical psychologist with over 12 years experience in clinical practice. She obtained her Bachelor of Science in Psychology and Masters of Science in Clinical Psychology from the University of Nigeria, Nsukka. She also obtained a Doctor of Philosophy, PhD from the Nnamdi Azikiwe University, Awka in Anambra State. Dr. Immaculata is a mental health advocate with competencies in helping individuals with psychological and emotional distress, as well as drug misuse problems. She promotes mental and emotional health, advocates for the prevention of mental illness, as well as eradicating stigma. She also manages people that are having difficulty adjusting to life challenges due to either depression, anxiety, or other mental health challenges. She is a member of the Nigerian Association of Clinical Psychologists and presently the treasurer of the Nigeria Psychological Association, Lagos State Chapter. Immaculata has received several awards. She received the 2024 Psychology Department Award for the Best Staff of the Year. Her hobby involves singing, dancing, cooking, and swimming. She's also married with children. Ladies and gentlemen, I want to urge us to kindly relax and listen to our mental health experts as we promise you a rewarding session of today's webinar. Over to you, Dr. Kemi Akitoyese.
Thank you so very much, the Medical Director, for that rousing welcome. And you would agree with me that the Medical Director has to start this conversation for us. Now, the topic again is aging night, thriving life, promoting mental well-being in older adults. Now, please, if you know anyone, friends and families, or even folks who needs to hear this, please tell them that we are live. And again, not only are we live here on the Zoom, we are also live on Facebook. So you can either join us here on Zoom or you can join us on Facebook for this intellectual conversation. And like the Medical Director had introduced, we have seasoned experts in the field of adult mental health, old age mental health, geriatrics, and others that would be able to talk to us so well about this, allay our fears and help us to be able to find better solutions to managing older adults and ensuring that we promote mental well-being. Now, Dr. Kilanche is ready to start this conversation with us. And she will be telling us how do we define healthy aging from the professional perspective, as well as what are the common mental health conditions that are associated with the older adults. Over to you, Dr. Kilanche.
Yeah, good morning, afternoon, evening to our viewers all over the country. Because I'm overwhelmed when your mentor and your teacher is the one giving your citation or introducing you for today's topic. Well, like my medical director has said, and thanks to the moderator for today's program, when we are talking about aging, I will start by defining the word aging, which is a biological process or is an inevitable process that happens from birth and grows as we and intensifies with age. And when we're talking about aging, it is a complex process that is progressive in nature and it is progressive. And when we are talking about normal aging, like I said, it's a progressive in nature and in the absence of diseases. So when we're not talking about how do we define healthy aging, this is a process whereby um, if people maintain their functional ability. And when we are talking about this functional ability, it's ability to do our basic needs of life. People should be able to interact or make their opinion known to the society. When you're a basic needs of life that you are devoid of any illnesses or any diseases, when you are able to contribute meaningfully, like what the WHO theme or definition of health is all about, is that it's the complete well-being in the absence of disease. So healthy aging as you are progressing from your birth and growing into adulthood, and you're able to contribute meaningfully, attend to your basic needs of life, and be able to contribute meaningfully to the society. And when we're talking about this aging, people grow older differently, as this is influenced by a lot of factors, such as genetics and environmental factors. And when we're talking about the environmental factor, we're talking about maybe ultraviolet exposure, use of alcohol or smoking, or in presence of chronic medical illnesses that can impair our aging techniques. So that is what all the aging is all about. Thank you.
Well, thank you, Dr. Kinachi. Well, Dr. Kinachi started this conversation with us today. And she mentioned the fact that it's a biological process. And it simply means that it's a progression, it's progressive. Now, I was looking at someone 2 days ago, and I was looking at that person, and I shook my head. And what I said to myself is, Penny, you're coming here. And I'm coming here not because I'm afraid of that reality, but it seems to be like it's a situation that we cannot, in a way, escape from, and simply means that there is a lot that we need to do in terms of preparing for it. Otherwise, you won't find out that you will get there, your energy drains, and you're not able to perform as maximally as you should. Now, Dr. King, I think in a definition page, he talked about maintaining functional ability, interactions, and making opinion known. And that's intellectual reasoning, devoid of diseases, as well as being able to make meaningful contributions and to the community. And that's what Dr. Kilante had spoken to us about in terms of how do we define healthy aging. Now, Dr. Makuleta will continue this conversation, and she will be talking to us about the factors that affect the mental health of older adults. Dr. Makuleta, over to you.
Thank you very much for the show. And for the mentioned there is the opportunity of become a loving and honestly for granted. Thank you very much for your mentioning there is. So, what do you talk about older adults? The mental health of this mental older adults.
Dr. Makulata, you need to unmute first.
Okay, sorry about that. So, as I was saying, that the mental health of adults or older adults involves the emotional, the psychological, and social well-being of every individual in later life. And there are so many factors that could affect this mental health. And we can see the physical and biological factors. And these are the body-based changes and health conditions that come with aging. And these can as well influence both the physical and mental well-being, like individual having chronic illnesses like arthritis, stroke, which could increase their risk of depression. It is real. And again, looking at these physical and biological factors, we can even see that many of them will be experiencing some cognitive decline, like dementia. And physically, some of them may begin to have this loss of mobility and independence that one cannot even move on his or her own. They will need support of either their family members or any support person around to help them. And this could as well affect their even self-esteem as well as some level of anxiety. And again, they also have face social and environmental factors like loneliness. And that's very, very important in these older adults. This is when they lack this regular contact with family members. Maybe they've lost one of the spouse, then they'll feel socially disconnected, especially when the children have left the family, and again, they don't have that ability to move as they used to. That could even affect their overall well-being. We can also see some of the factors in the lifestyle and economic factor. It's one of the big issue in older adults. It's when you look at retirement, it will lead to loss of purpose. Yes, that is very, very correct. And this is because, you see, leaving the workforce can lead to a sudden identity crisis. One may begin to feel boredom and even lack of daily structure or reduced daily routine. So when you now look at this, it could be associated with some level of mental health challenges like depression, anxiety, or even sleep disorders. So these are some of the factors that could affect the mental health of older adults. Let me stop here, Ma. Thank you, moderator.
Thank you so very much. And what Dr. Immaculata had brought to before has to do with the realities that are often confronted by older adults. Sometimes you're not able to play the role that you used to play. Now it brings to the fore the question of your usefulness, meaning authenticity. And this kind of tends to challenge the effective functioning of the individual and a whole lot more. Now we're just starting, and like I said earlier, please just invite someone around you, friends, family, or friends, and then come and hear this, because this is something that we must amplify the conversation about, so that we can all begin to prepare for the biological process that Dr. Like we had mentioned earlier. Dr. Makulita talked about the physical, then the emotional, psychological, as well as the social factors that can affect an individual, which invariably will tend to affect their mental functioning. Now, Dr. Kula would also be talking to us now about most times many people believe that depression and memory loss are a normal part of aging. The moment you talk about somebody is not able to recall very well, or somebody is feeling sad a bit, you now hear that that's normal part of aging. How true is this, Dr. Kula? And the way should family become concerned? And then again, please highlight other signs of mental health conditions that older adults could also be experiencing. Over to you, Dr. Kula.
Thank you very much, moderator, for that question. The question that a lot of people attribute aging with memory loss, this completely false, as it is not true. It deviates from the normal, and this is one of the biases people have about growing older. Because as we grow older, we believe that there are some cognitive changes that happen inadequately. Let me use the word inadequately. But when we are talking about depression and memory loss, it does not connote aging, because it's one of the stereotypes, one of the beliefs that we have, that when somebody is growing, as you grow older, you know your memory functioning will be declining or will eventually be lost. Whereas they're talking about a different mental health issue that the older age group could be predisposed to as they grow older. So it is completely false for an old people to that it's common to them to have depression and memory loss. As when we are talking about memory loss, one of the common mental illness that is commoner in the elderly, we have depressive disorder, which Dr. Immaculata has discussed about. This is one of the most prevalent mental health issues that the elderly have. And there are a lot of factors which may be predisposed to this or that could cause this one, such as loneliness or recent bereavement, or as they're growing older, issue with their mobility. A lot of them start getting worried. And for you to know that for the depression in the elderly people, it does not even come with the normal symptoms that we know. My mood is not, I'm not happy, I'm feeling sad. For the elderly people, the depression you see in them present in an atypical way. Most of the time, they present with somatic symptoms, mostly pain. A lot of them will complain of pain. I'm having this pain. I'm having this pain. Whereas they are trying to cloud or um, downplay the depressive disorder they are having. Then also another symptom that they could have is the issue of this undue belief that feeling of guilt, what we call nihilistic belief that I'm having a chronic sensation. So it's not a typical depressive symptom that you see in the elderly. Because when you are already seeing depression in the elderly, it indicates another it shows that there is a problem, a mental health issue that needs to be properly addressed. Also, memory loss in the elderly, which usually presents with forgetfulness or undue belief when they are missing their way or misplacing their things, and they start accusing people in the house. This is another mental health issue that the elderly people are predisposed to. When you are having memory loss, there are some things that we need to reassess in this kind of people, which to us it goes a long it goes beyond misplacing things because you still see some other symptoms like them accusing family or relatives of after them or trying to steal their things, which is not really part of this thing. So another thing is anxiety disorder, which is common in adults too. This is another health issue that the elderly people or as one grows older are prone to. And anxiety comes with the fear of being forgotten, the fear of being lonely, or as you go, you know, like the stereotypic belief that when somebody is 60, you are automatically reaching the age of retirement. So anxiety issues come in. People start becoming unduly worried. Oh, when I retire, what will I be doing? What will am I not going to be abandoned? Or this Japa syndrome that a lot of our younger generation are leaving the country, leaving their aged people to themselves. So the fear of being, oh, who will now look at me in my old age crept in gradually, and before you know, they become unduly worried about it. Then another one is substance use. This one cannot be overemphasized. A lot of people don't know that when people grow older, because of they downplay some of their symptoms, some of our aged people start substance use. I'm not talking about substance that we all know, weed, smoking cannabis or something. These are some of the use of misuse of some analgesic opioids because of this pain they are having, or because of they have other challenging medical illness. So they start you abusing some of this medication. Before you know it, they become dependent on analgesics. Another one is benzodiazepine. This one can never be overemphasized. In my clinic, I'll see people come in. Oh, doctor, can you give me some drugs to make me sleep? Because they have issues with sleep. So as people grow older, there are a lot of things that come, mental health issues that crops up that we need to really address. So saying that memory loss and depression is common now, or it's part of aging is completely false. As it's a different mental health issue altogether. But as we grow older, we expect of little or mild cognitive decline in the older age group. Thank you.
Thank you so much, Dr. Kilanche. Dr. Kilanche said, as we grow older, but those of us that are now old, that we are experiencing cognitive decline. The big phone will not know who to call again. I don't know what is wrong with that. You'll see diagnose me today and then you'll be able to help me. But there was something that you said, which is also very germane. I recall that a few days ago, an elderly person in my church, after I get some analgesic and anti-malaria, which I obliged, and I did. And then and I was surprised and I said, come on, that drug has finished. I will need another one. I said, which other one? Are you still sick? He said, no, I want to just keep using it so that I am okay. I think you are now very, very okay. And that's all the trend for a lot of them. They want to use substances, maybe not the illicit ones, but then they would want to use it just to be able to keep attuned with being healthy and being alive. So thank you so very much, Dr. Kilache, for highlighting some of these core symptoms that individuals who are at this stage might be experiencing, which might not even be things that will take note of, to mention the fact that there could be pain, there could be guilt, there could be falling sensation, and it will be perceived differently and not even be treated for what it actually is. All right, now, so Dr. Nakuleta will be talking to us about loneliness. And loneliness has been described as a silent epidemic among the older adults. Now, let's look at the impact that the social isolation has on mental health and what are the best interventions to guard ourselves from this. Over to you, Dr. Nakuleta.
Yeah, thank you very much, Emma, for that beautiful question. And it's very, very important. There's no way you can just talk about the aging without talking about the social isolation and loneliness, because social isolation and loneliness, they can increase the likelihood of mental health issues in adults, like depression and anxiety, or even dementia. Because when you look at social isolation, is a lack of social contact. And again, loneliness itself is this painful feeling of being disconnected. So when you bring these two together, it could now act as a severe chronic stressor that can damage both the psychological and neurological health in older adults. So looking at the impact it has on the mental health of this elderly, you now see cognitive decline. Social isolation deprive the brain of the cognitive stimulation. When we talk about this cognitive stimulation, this is what speeds up the onset of Alzheimer's disease and even other form of dementia. And again, other impacts could be severe depression and anxiety. You see, the absence of emotional support could trigger some feelings of worthlessness, persistent sadness, and even anxiety. Yeah, some people don't talk about suicide in the elderly. This could be an impact that loneliness and social isolation could cause among them, because they now face this loneliness. Everybody has left the house. Maybe they may experience a death of a spouse. You now see that so many thoughts may begin to come. Some may begin to see themselves as worthless. What am I even still doing? And this kind of negative thoughts might begin to come. And you now see some of them will start to self-medicate using overdose of their even prescribed medications, which could as well lead to suicide. Yeah, Dr. Kilache made mention of substances. We see nowadays that older adults also engage in substance use. And when we talk about this substance use, you see alcohol. All these roadside, the sachet one, they tell you that, oh, it makes them feel good. It makes them feel all right. And with that, gradually, it might create other form of mental health challenges. and it has looking at the intervention, fine. There are some evidence-based intervention that could help in managing these situations. Then we have psychological and cognitive interventions like cognitive behavioral therapy, CBT. This therapy helps the elderly to really identify, challenge, and challenge especially the maladaptive thoughts regarding social interaction, like fear of rejection. Do I fit here? Are you sure they will accept me? So the cognitive behavioral therapy will help to challenge this negative thought. It's quite maladaptive. It will also help them to be withdrawn from other people. Again, there's this thing we call reminiscence therapy. This is a situation whereby you bring the elderly together, to share their experiences during their work days, their growing up, and all that. It helps to validate their life history and even foster deep, immediate bond with those people, those their seniors. So it helps them a lot. And again, even community-based program can as well help. In this community-based program is where you now bring the adults, the young children, they will tutor them. There are some skills they will impact. It also make them have this kind of set societal value, storytelling, teaching them some skills, maybe young girls that are about to get married. It helps to restore this sense of societal value. Oh, I'm still valued. Oh, I can still make impact in these areas. These are very, very important. One of the ways in which you can still, help the elderly. But another important thing that, some people that have learned that is this technology-assisted program. Some adults now, bringing them together to teach them how to make use of devices. Technology now is we are modern age. Teach them how to use do video calls, connect with their family outside. So it helps to avoid this boredom and loneliness. So when you begin to teach them all these things, it helps them to navigate loneliness, being bored. They still make them feel belonged, in as much as their families, their children are no longer there, they're alone. But yeah, I know of one woman, she's always on phone. Oh, where you, and it's like, oh, let me call my daughter so that she will send tips for me, so that with that, she will keep on communicating. This helps them to do what? To be always feel valued, that they're not being left out. They still see their family members that is even very far, far, far from them. I think this is one of the things that we can still help to manage them, and it's very, very important and evidence-based technique in managing the situation. Thank you very much, moderator.
Thank you so very much, Dr. Immaculata, for that. I recall at the advent of the coronavirus, we were into the home, and there was a day my mom called and she started crying, like, "Oh, nobody's able to come. I can't see my grandchildren." And I had this word funny, but it was something like, is it as much as this? Because every year the grandchildren will go. So we had to initiate the Zoom session where we saw everybody, and that calmed their nerves, and that helped her to navigate that period. And I will tell you that loneliness can be real. You could be in the midst of a lot of people, and yet you still feel lonely because of it. And as you had said, helping them to walk through becomes very significant. And creating a society or a community that would help you to be able to also stay strong in periods like this. Because you can't tell the children not to go. Their reality will take them out of your space. But then again, you can build another community and navigate that space effectively. Now, Dr. Kumansha will be talking to us about the issue of stigma. Now, when you see older ones, most times we associate them with, especially in this part of our own world, we associate it with quite a whole lot of things. We associate them with witchcraft and witches, and it's quite a whole lot of things. Especially now when this individual now have either Alzheimer's or memory issues, dementia, among other things, we tend to, stigmatize them. And this makes it very difficult for them to, access care and get the help that they need. Now, Dr. Finance, how can we change societal attitude and also now encourage the older ones even to seek help as early as possible? Thank you. You are muted.
Thank you very much, Madam Moderator, for that question. So when we are talking about stigma to the elderly is not, or let me start, stigma or mental illness is not only to the elderly. How do we, the populace, understand what mental illness is all about? And stigma surrounding mental illness in later life creates a barrier to us seeking appropriate help to the causes of these mental health challenges in later life. And these causes could be different in our perception, what we call ageism, that what do we believe, or our attitude towards what mental illness is all about. Or some people expect that as we grow older, like the question you asked me before, we all believe that, oh, when mama is forgetting something, oh, it's one of the symptoms of aging. Don't let me bother myself about it. Or when mama is keeping to herself or not interacting with the grandchildren as supposed to be like, oh, part of the aging people, maybe mama does not want to be disturbed. So it's part of the stigma that surrounding mental illness, which inadvertently delay seeking help for proper treatment. And this often leads to what we call social isolation, delayed diagnosis, and untreated symptoms, ultimately impairing our well-being. So what are the impacts, or what are the things that could causes this stigma? When we are talking about the generational perception, even the aged ones, they grew up in the area where mental health issues are not well understood. When they too, they feel that, oh, some of these things is part of normal aging. So they too, they do not even know that there's a problem. So there's already interpersonal stigma or ageism to their own issues. So they're not even ready to tell their children or to seek help. And because they understand it, so mental health are not even well understood in them. So they did not even bother to explain to people what they're actually going through. Then another one is access to mental health facility. Most of the time, seeking help, and because as we talked earlier, growing older, people may have issues with their mobility. So these older people seeking help is another issue to them. So instead of them to seek help on time, because the healthcare facility is a bit distant to them, they will not seek help because it's not easily accessible and affordable. Then the issue of finance cannot be over, right? Like Dr. Makulata has already talked about. Finance, people feel that the mama, instead of telling them, they'll be like, oh, I'm going to create additional burden of finance, because most of this, our healthcare services, is paid out of pocket. So you're already thinking, oh, instead of me increasing the body, financial burden on my children, don't let me internalize my work. Let me just accept it. It's part of my growing up. If I want to grow up, there are some challenges I must go through. So before, instead of them telling them, they continue internalizing or dismissing their symptoms as part of normal aging in quotes. So how can we challenge this barrier? Advocacy cannot be overemphasized. Advocacy at government level by making sure that we all see mental health challenge like physical illnesses. That when they are doing or when they are that mental health care is a fundamental aspect of health. Like the government pay emphasis on physical health, like hypertension, treatment of hypertension, diabetes. There should be advocacy, encourage mental health awareness, so that when people are experiencing some of these symptoms in later life, they will be able to know where they are going to seek help and accept treatment early. Then in addition to this advocacy, I will talk about community program. That is public educational campaign. And the media, the use of media, it's key in this public health awareness. Because most of this media, what we see on on our media, is showing an elderly patient. Maybe mama is suffering from dementia, memory loss. Mama is saying so irrelevant speech, talking out of context, or saying attributing things that mama is not doing. And before you know it, the media has already, the populace has timed it. Mama is a witch. Mama is a witch. So, and not knowing that mama is having cognitive decline, dementia that could be treatable. And so we should encourage in public education awareness and bring out all the positive things that, oh, the mama that you thought was a witch is actually a mental health issue, dementia. And we promote the positive impact of treatment to the populace so that they will know that, oh, so all these mental health challenges can also be treated, and we encourage the positive outcomes and challenge the stereotype that when mama is sitting down alone or talking or a chronic sensation, or mama is saying this, so we start attributing it to witchcraft or so on. So we challenge the stereotype. Then also by integrating mental health care to primary health services. Like I said, it's one of the challenges that fuel the stigma. It's when mama has to travel a long distance to come and see us in quote in psychiatric Yaba. But if mental health service accessible to them, it's in their primary health care where they assess their care for their physical illness, maybe hypertension or diabetes. It's easier for them to walk into the health center and explain their symptoms to the doctor instead of saying that I'm bringing my mama to Yaba Psychiatry Hospital, that itself has already produced stigma that is your mama having mental illness or is mama running mad? But when it's integrated into the primary health care, people can walk in as they are complaining about their physical illness to their doctors. They can also say that over in the last week, I've been having this feeling that maybe my sleep is not adequate. I'm having this sensation, so that it could be adequately treated on time. And it will make them easily accessible and affordable. The training of healthcare personnel, those in the healthcare service, in the primary healthcare center, should be retrained and retrained to be able to identify the basic symptoms of mental health challenges. Because at times, mama may, because of their, as people grow older, they are prone to some medical illnesses, coupled with all the drugs. Mama will just be swallowing different medications and some infection that is treatable. And so by the time they get to the primary health care center, it could be easily treated on time before, and you reduce the burden on the specialized center, like our own big center in Coast. It will be easily accessible and even reduce. Then also, like you rightly said, when mama, during the COVID era, now, medicine has gone global. Issue of telemedicine cannot even be overemphasized. The aged people that have issues with their mobility, we can offer them what we call telemedicine. And I know my medical director is here online and is already working towards in that aspect so that people, the elderly people, can access care in the comfort of their home, in the comfort of their home. Explain to their doctor the challenges they are going through. You don't afford the caregivers, the opposite to be able to see, because at times one of the challenges is the caregiver has to leave their own primary abode to go and pick our aged patients wherever they are living, then come down to Yaba Psychiatry to access care. But in case of telemedicine, everybody is in the comfort of their zone, their comfort zone, and you can access care with your healthcare professional. So in this way, also help in mitigating the stigma associated with mental health services. Thank you.
Thank you so very much, Dr. King. So that's a lot to swallow. And Dr. King actually had told us, yes, there are stigma But it's not come because some of these things that are myths are true, or more because the society doesn't understand what aging is all about. And if we are not trained, then there is a possibility that we will most likely mismanage individuals, or we will not even be able to prefer the best health. So every one of us needs to understand it. And there was something I was sharing with my mom some time ago. I recall when she entered into menopause, and then she was having some menopausal issues, and then she would talk about this. We would laugh at her and like, excuse me, why are you talking like this? This is not real. It's not hot. The weather is cold. They were having hot flushes. I'm like, but no, it's cold. But as we are going on now, we now know that what she was saying was real. And so it is we cannot connect. And until we begin to have knowledge-based information like this, we will not be able to connect with quite a lot of things. And the older ones are most likely no experience. Another calculator will be talking to us about the lifestyle factors that can promote a healthy brain aging, and which will also reduce cognitive decline. Over to you, Dr. Makulator.
Thank you very much, Ma, for that question. Yeah, looking at the lifestyle and the habits that could help and promote healthy brain aging. Yeah, there are quite a number of them. Yeah, because lifestyle and even habits can as well stimulate the brain's ability to adapt and grow, and that is neuroplasticity. So, and some of these lifestyle could be just exercise, physical exercise, engaging in small exercise like walking. No, some may not even swim, but some that can still do that, fine. It's very much welcoming. At times you see some elderly riding bicycle. It's also a way of keeping fit and help to stimulate their brain. If one can still do that, it helps, it increases the blood flow to the brain and even enlarges the hippocampus. That is the region of the brain that is responsible for memory. So it's very, very important. Those small exercises, it helps the blood to flow very well to the brain. And again, we also need to watch what we eat. Healthy diet is also part of it. What you eat and drink is very, very important. And there are some good food that will still help in supporting the brain, like vegetables and nuts, and limit some food like butter, sweet. No, those one is for babies now, not for the elderly. No, some of these things we eat will help to support and what we drink as well. Someone was telling me last time that, oh, my dear, you will not understand. Life there for green bottle. I don't understand green bottle. That means, oh, that is only one bottle. One bottle is okay. I am fine. I will relax. But one thing with all this alcohol, from one bottle, you move to two bottles. So we have to be mindful of what we eat and what we drink. Another important one is continuous mental stimulation. So you need to stimulate the brain. As an adult, you can pick up a skill. You can even start to learn some languages. This is just a way to stimulate the brain. Master new technology. Even the phones we use now, many of them are very technical. Some may begin to, practice them. It helps to build the brain very, very well. And again, one can even do some, engage in some cognitive demanding hobbies like chess. So people may see them, oh, this man is lazy. What is he doing there? These are the ways to stimulate the brain so that the brain won't just be dormant. Just pick up some of those things, puzzle, or even reading. It's very, very important. It helps to keep the brain active. So the brain needs to be actively engaged. And you know what? If it just maybe passive activities like watching television. See, it doesn't offer the same protection like engaging in all these demanding, the one that is cognitively demanding, like playing chess or reading. So it's also very, very important. Another important one is sleep. Sleep, sleep, and sleep. Yes, sleep is one of the essential, plays an essential role to the brain, because you know what? It strengthens the memory. See, adequate sleep improves concentration and helps to stabilize emotion. So an adult should aim at least 7 to 8 hours of sleep, quality sleep. Not every distraction, you can just push them aside and sleep. It helps to build one's brain. Like I said earlier, an adult need to say no to any form of substance. Limit alcohol use. Once you quit any form of smoking, reduce your alcohol intakes, it helps to do what? Build the brain. I think this is one of the some effective lifestyle that could help to promote healthy brain aging and even reduces the risk of cognitive decline.
Thank you so very much, Dr.
Thank you very much, moderator.
for that. And one of the things that you had said to us, aside from sleep and other things and exercises and making it a perfect, you must keep using that brain. And one of the things I've found out with the older ones is you don't want to sit and feel as if life has gone by and they cannot meet up again. Now you can't meet up, that brain can be pretty. And the Killer Show will be quickly talking to us about managing the aged and individual with mental health. What are the options? What are the treatments that are available so that from this webinar, people will know what to do and where to go. Over to you, Dr. Kilansho.
Okay, thank you very much, ma'am, for the question. So how do we manage our aged patients? When we are talking about management, it's an holistic care that we intend giving, which involve the biological intervention, the psychological, and the social intervention to make treatment holistic. So our first, most times when they present with their mental health issue, medication may or may not be required. And even when we're talking about medication, some of the symptoms may be amenable to low dose antipsychotic or antidepressant, depending on what the severity of the symptoms they are presenting with. And when we're talking about the medication, we usually say you start low and go slow. And this medication, so that because like I said earlier, if we are doing there are decline in some of the activities in the body. So we don't want to overload them with the medication. So when we are giving a low dose of whatever we are giving them, which need constant monitoring, so that to prevent the adverse effect of this medication that we are giving them. Another way of managing our this mental health issue is psychotherapy. This cannot be overemphasized, especially what we call cognitive behavioral therapy. And this helps to challenge their cognitive distortion in quote, their negative belief or their stereotype or their belief about what they perceive of what is going on with them. So we always encourage psychotherapy, to, this cognitive behavioral therapy, in also managing them. Then another one is what we call psychosocial intervention. This is germane to the elderly. Like you rightly said, then some of these mental health issues were due to their maybe perceived loneliness, social withdrawal. So when there is such psychosocial intervention, like you make this our aged people to participate in the community. There's a social connection which is paramount to their well-being. Like in our maybe churches, you give this aged people, you can imagine when they come to the church, and you give them like a little role to do, the way they will go out, all out to be like, oh, you've given them, which invariably increase their self-esteem, and help them to reduce their late life depression and be able to help them to provide solution, because we all believe that, oh, when you give them, and it also foster relationship when they come across people in their age bracket, they'll be able to relate, share life ideas, and increase social interaction in them. Another one is lifestyle adjustment. Dr. Makulata has talked a lot about physical activity, maybe what I will just say walking, some activity that is tailored to their age. I wouldn't expect an elderly people to come and start mountain climbing, mountaineering, or maybe walking that is specific for what they can. As walking help to boost their cognitive functioning and help to reduce anxiety or agitation. Another one that she talked about is brain stimulation. That is, you give them activities, picking up hobbies, like you rightly said, learn new languages, pick up skills, maybe knitting, modeling, creative, or planting. This helps to stimulate, because I want that the patient that and we are like, okay, what can we do? Okay, let's just start planting, because of just get a flower in a pot. You know, it stimulates this cognitive function. I need to water this plant today and encourage them. Oh, this nurturing aspect. When you see her in clinic, she'll come with her plant. Oh, I water it today. I'm even the one that led services in our center today. So it increase their self-esteem, it boost their morale, and increase their cognitive, um, improve their cognitive functioning. Another one is holistic wellness, maintaining a balanced diet. We call it some Mediterranean diet in code. That is increase your grains, nuts, and fish that is rich in omega H3, then sleep. She has also talked about that one. Then another key thing that is germane to the management of these elderly people is environmental manipulation. Because some of them are aged, and as they grow older, they may have problem with their vision, visual impairment. So the environment should be tailored to suit their needs, by make sure that the place they are in are properly lighted. And if they are staying in a story building before, you can make them come downstairs, put up a ramp. The steps should, even if there is a steps, should be guardrail to prevent fall, because they have issues with their mobility. Then their toilets, you can put the. Then lastly, caregiver support, because taking care of the aged people is could be very exhausting to a singular person. So you can give support to the caregiver, and all this can make treatment holistic for the aged patient. Thank you very much.
Thank you so very much, Dr. Kilanche. I know quite a lot of information to give us, but we do not have the time. Now, Dr. Immaculata is going to talk to us about what Dr. Kilanche just rounded with, and that has to do with caregiver support. Now, in dealing with the aged, we understand that most times the pressure is more, which can lead to caregiver burnout, which is becoming excessively more in our society. How can caregivers protect their own mental health? Over to you, Dr.
So thank you. Thank you very much for that question once again. Yeah, let me say this in my language. They said, that simply means that he who takes care of the sick, he himself is also sick because of the associated burden of caregiving. And let me tell us here, taking care of oneself is not selfish. See, caregivers can still protect their own mental health while taking care of their older parents or older adults by simply doing what? Practicing strict boundary. There is need for them to know their limits. Say no to extra demands. They need to decline from non-essential tasks, from extended family. For instance, this is long vacation. You see, oh, this person is taking care of the aged mother or even the mother-in-law, and the big auntie say, oh, my children will be coming for holiday, and you want to accommodate all these things to yourself. There is need to set that boundary, because he who takes care of the sick is also sick. There's so much burden associated with caregiving. And another thing is that there is need to utilize professional respite care. What do I mean by that? There is need to enroll even adults in professional daytime centers where they can socialize with others while the caregiver is at the same time taking care of him or herself. Because when you talk about caregiving, it's not only women that does that. Even men, they also do that. So there is need for them to in this kind of take part in this kind of professional respite care. Then there's also need for them to prioritize their own personal health. It's very, very important. Attending personal appointment, seeing the doctor, going for your own checkup, because of the body, when you hear burden of care, it's not just bringing money. The emotional toll that is there, there are a whole lot. So body physical health, as well as the mental challenges, if there is any, maybe the individual is having health issue, there's need to work on that immediately. And again, regular monitoring. Is there anything like warning signs where I'm not feeling it, maybe burnout, you are having issue with your sleep, easily irritable? You are taking care of mama, you are taking care of papa, but any slightest in this has not been the usual pattern. But even some may even begin to add weight, not minding that this person is actually need to do what? Check out for these morning signs for, and again, go for immediate intervention. This will help to make sure that the caregiver himself is also healthy in taking care of this person that is sick, so that it will not get to a point whereby 2 or 3 people are down and you now employ another person to continue with the work. So he who takes care of the sick, please, is also sick. And we, any of the caregivers, need to take care of his or her health. Thank you
so
very
very much,
much.
Dr. Bakuleta. We do not have the luxury of time today, but I want to believe that a whole lot of information that had been passed, even with the Igbo language that had been spoken, is quite least well received, so that that would help us. We really do not have the luxury of time today. I want to believe that these things or this information helped us so well, ranging from the common mental health conditions, or even breaking the myth about the fact that memory loss and depression are statutorily part of the aging process. And the Kekelanchi had told us no. And the Kemakulita has also reiterated the fact that there is a lot more that we can do in terms of ensuring that we deal with loneliness, among the fact also that we can also help individuals to begin to come to terms in terms of community bonding, among all the things like that. The Kekelanchi had reiterated the fact that typical symptoms might be common in the elderly than the physical or the common known symptoms of depression that we would see. But with that as may, let me borrow the words of my medical director. The truth here is that we can thrive adequately as adults or even in the old age. And so we can say the mind can grow, the mind can thrive, the mind can flourish, and we can promote adequately mental well-being even in the elderly. We do not seem to have so many comments and questions in the chat box today, but I want to believe that all that we had said today had been well received. We do not again have time again to even take these questions or comments, even if it's coming in, because we are already past our hour. Usually we spend 1 hour. So until we come your way again, next month, by the grace of God, we would be asking our speakers to just give us one word that they would want family and members and caregivers to remember as we talk about promoting better well-being even in adult life. Dr. Philanthropy, one word that you want family members to remember. Over to you, Dr. Philanthropy. 1
Thank
minute.
you very much, Madam Moderator. Well, I think, well, my parting shot is that aging is an inevitable process that we all aspire to pass through. But despite considerable challenges that may occur in the body as we grow older, we can still attain pleasurable competency in our adulthood and be able to we can pleasurable and live an healthy how would I put it? So a better understanding of factors associated with aging will help us to prevent some of these factors that can predispose to mental health issues in the elderly. Thank you very much.
Thank you so very much, Dr. Philanthropy. And what you had said is you have a lot of control in terms of what you do. Dr. Makuleta, over to you.
Okay, thank you. So one thing that we just either the adults, family member, the caregivers, healthcare professionals, there's need to prioritize meaningful human connection and preserving an individual sense of purpose. These are the most powerful tools to protect and restore the aging mind. Thank you very much, our dear moderator.
Thank you so very much, Dr. Immaculata, for that. Meaningful connection, purposeful living, these things are very key and very germane to our functioning. And so on behalf of the medical director, Dr. Olugbengade Owoye, and to our dear speakers today, Dr. Philanthropy, Dr. Immaculata Isiaya, thank you so very much for being on this call today. For everyone who has joined us, thank you so very much. Please understand that the recording of this webinar, as well as the previous episodes of the Yaba Voice webinar, is on the Yaba Tube page. You could just access that. Just Yaba FMPHY, Yaba Voice FMPHY, and the Yaba Voice page of the YouTube. You will be able to access this recording as well as the previous episode of the Yaba Voice webinar. So until we come your way again next month, please ensure that you stay safe. Remember, you can age beautifully, you can thrive, and then you can also flourish. You do not have to live with any form of disabilities. And if you are taking care of people who have mental health conditions or who are aged, then please understand that you're also very important in taking care of them. To everyone who had reached out to say thank you for our speakers, thank you too also for joining us. Until we come away again, please stay safe. Bye-bye. Thank you so much.
Bye-bye. Thank you for listening. Thank you.
Thank you so much.